promised you a few weeks ago that we were going to talk about embalming. So here we are, we have our mannequin, and I'm in the prep room. Two things I want to say before we get started. As you can see, I am not wearing PPE. I'm only wearing gloves, and I'm wearing gloves because I'm touching the hose, and I'm also going to be touching the bucket, which is actually underneath the embalming table after we finish doing this video because the bucket needs emptied. I'm also not going to get into a ton of jargon that you don't understand. We are going to keep this very simple and to the point. If you do have any questions regarding the embalming process, please comment, reach out to us and ask. I am not here to use big words to make myself look super important and like I know something that you don't know. We want to explain this in a way that anyone would understand and just keep it short, sweet, and to the point. We are back here in our prep room. We have Bev, our mannequin, on the embalming table. Once we have someone in our care, it is important for us to communicate with the family and find out, are we moving forward with cremation or traditional burial? And if we're moving forward with traditional burial, are we having a public viewing? And do we have your permission to do the necessary prep work and the embalming? Embalming without permission is considered mutilation of the human body. If you did not know that, now you know. We have Bev here, and Bev needs disinfected. So one of the first things I do once I get someone on the table is I disinfect. I'm losing my hose here. I need to disinfect the eyes, the mouth, up the nostrils, under the arms, and down in the groin. This is a special disinfectant that we get from our chemical supply company. After I have sprayed those orifices, I need to clean them out. So I'll take some cotton and we'll clean. I would also typically spray inside her ears, but because of her nice pretty hair, I don't want to ruin that. I can twist some cotton around these forceps here and get up into the nose. I can also do the same with the mouth as well. It's really important to disinfect the mouth. The mouth is a breeding ground for bacteria, so I can take some more of my cotton here, twist it around the forceps, and get into the mouth to clean. After we've done that, Bev is obviously a woman, but Bev needs shaved. We have a lot of little old ladies come to us with facial hair. We need to clean that up. So we would shave Bev. Now, if we had a man here on the table, we would obtain permission from the family to keep a beard, keep a mustache. Usually the family communicates that with us though, but if a man has facial hair and he always has it, that facial hair is going to stay. We have disinfected her, we have shaved her. One of the next steps is closing the eyes, and I have eye caps right here. This is an eye cap, and one of these gets placed over each of the eyeballs. People will come to us with their eyes open after they pass, or sometimes the eyes are closed. Either way, we need to pull back the eyelid, place this on top of the eyeball, and then pull the eyelid back over this eye cap. I also need to close the mouth. Every embalmer is going to have their own unique ways of doing anything in the prep room. Some embalmers will prefer to use a needle and ligature. Others will prefer the needle injector method. This is what I typically start out with when I need to close the mouth. We have these wires here that get inserted into the needle injector, and we need to inject these into the upper and lower parts of the mouth. A lot of times you have people that come to you with deteriorating gums, and this method does not always work. So then this needle here and ligature would be my backup. Now, the next step, after we get the wires injected into the mouth, assuming that is going to be my method of closure, once these are injected into the upper and lower parts of the mouth, we then tie the wires together to close the mouth. We need to make our incision. I will always go for the jugular and the carotid first, unless I know I'm going to have issues. And typically I can make those determinations and decisions once I have someone on the embalming table and I take a look at them when they first get here. But Bev, we're gonna say Bev's a normal case. She's not going to pose any issues for me as the embalmer. So I would make my incision here on her clavicle about 2.5 inches in length. And then from there, I can gain access to the carotid and the jugular that are over here. Someone had posted on our Facebook earlier this week. They said that when we raise the carotid and the jugular, we cut the neck. No, we do not cut the neck. We cut down here on the clavicle. Now, if I'm having issues with blockage, maybe I'm seeing we're getting good coloring and good distribution down the left side. Maybe I'm not getting the best distribution down this arm in particular. I can raise the axillary or I can raise the radial as well. And again, that's just done by making an incision, raising those arteries, cutting the artery, and injecting. How do we cut the artery? What does that process look like? We have our hose here. I have my scalpel, and we have our artery. We raise the artery, cut the artery about halfway, and this cannula gets placed down into the artery, and that's how we inject. After I see that the decedent is embalmed, I need to inject up the right side of the head. So I switch the position of the cannula and inject. How do we drain? After we cut the artery, we need to cut the vein. So I would cut my jugular about halfway, just like I cut the carotid. I would place these spring forceps down into the vein, and the purpose of these are to clear any clotting during the embalming process. Everything drains down here, down the side of the table, and goes into the toilet at the end of the table. I'd like to back up for a minute and just say that if I do have any distribution issues with the legs, which does often happen, I do have the option of raising the femoral artery as well. You can raise any vessel, but these are my go-to vessels that we have discussed in this video. After we finish the embalming, we need to treat the cavity. This here is called a trocar, and the way that this works is this is connected to a hose that will suction out contents from the abdominal cavity. There are 9 different regions here in the abdominal cavity. Obviously, each region contains different organs. We need to empty the contents of those organs. Cavity embalming is really important. This is something that you want done. It is part of the embalming process that you are paying for. This is going to help and eliminate any potential purge issues, bloating, gas buildup. What we do here is we take our trocar and we go about 2 inches above and 2 inches over from the belly button. We puncture and go into the abdominal cavity, and then we move this around into each of those 9 regions to empty the contents from those organs. After that is completed, we need to treat the cavity with cavity fluid. I attach a bottle of cavity fluid here, and then this kind of looks similar to the trocar. This goes back into the same area that we went into initially, and we inject the cavity solution like that. After that is completed, we need to take our trocar button, literally looks like a button, and then we close that little area on the abdomen. Then we need to wash the individual. So I'll take my hose, I will spray them down with water. I wash the ears, I wash the face, I wash everywhere. This is the final bath that someone is getting that you've heard me talk about. We also need to wash the hair and just clean someone up. After that is completed, we move them over to a dressing table. We will position the arms back to how we want them during the viewing, and the individual stays on the dressing table at least until the day before their service. Usually we prefer to dress and casket the day before a service. That's it. Very simple explanation as to what happens during the embalming process. I will tell you, what you have heard, what you've learned, what you think happens is probably pretty far from what actually happens here in the prep room. There are times where I move someone off this embalming table and I get them onto a dressing table and there's barely any blood on this table. It is not as gruesome and gross and awful as what you have been taught and what you think it is. Any questions you have, drop them in the comment section. I'd love to answer them for you. Thank you for watching.